Good morning and thank you for joining us. Today is a big day. I'm sure most folks already know that Lane County was approved to move into phase one, the governor's reopening, and we will be addressing that. We are joined today by our local elected officials. We will begin with Chair Buck, Commissioner Buck, and then move on to Mayor Vennis from Eugene and Mayor Lundberg from Springfield.
Good morning, everybody. Last Friday, Lane County submitted our application to enter phase one with the governor's reopening plan. And that would begin to loosen some of the restrictions on restaurants, personal service providers, and malls and gyms. We just heard this morning from the governor's office that we have been approved for our moving into phase one, and will allow Lane County businesses to begin the process of reopening as long as they can do safely in accordance with the state's guidance. While the governor's office has taken the lead in determining what is or is not included in the reopening phases, Lane County and its local partners are responsible for evaluating our readiness to continue to respond to our COVID-19 cases. We remain focused on ensuring our hospitals, medical providers, and first responders continue to have access to all the personal protective equipment that they need. We're putting measures in place to reduce potential future demand on hospital beds and resources by creating a facility that can provide a safe place for people with COVID-19 to isolate, should they need that during a recovery when they don't have resources to do it themselves. We are carefully tracking the contact tracing, expanding testing, and Sentinel testing so that we understand more about where it exists within Lane County and how it might be moving through our population. To that end, we're expecting to receive Abbott rapid testing machines at 6 of our community health centers. We have been on the waiting list for those since March. This will allow Lane County to more quickly serve our community health care patients and increase overall testing capacity in Lane County so that we can better track this virus. We continue to see the number of active cases decline in Lane County. Currently, we have no hospitalizations and 51 people have recovered. Lane County will continue to monitor the hallmarks of testing, case numbers, hospitalization, and PPE equipment as we move through phase one. If we see significant increases in the number of cases or people that might be hospitalized with COVID-19 like illnesses, we are prepared to reevaluate if they can continue with phase one or if they can proceed to phase two. Our commitment to the safe and healthy community in our county remains our highest priority. We will continue as the county's public health authority to respond to COVID-19, while at the same time we will begin our efforts to increase a focus on supporting recovery, including economic recovery and the recovery of our vulnerable populations. We encourage everyone to follow the governor's guidelines so that we all have an understanding of what those guidelines are and we can help our loved ones, neighbors, co-workers, and others be safe while we cautiously what our new reality will be. Thank you, and I will pass this off to Mayor Vennis.
Thank you, Commissioner Buck. Thank you all for joining us this morning. As the Commissioner has just reported, Lane County has been approved by the state to enter phase one of reopening Oregon beginning this Friday, tomorrow, May 15th. This is big news for our community. As we slowly begin to reopen our county, we must continue the good work we have done in the community so far. Even during phase one, we need to remember that vulnerable populations should still stay home, including people over 60 and anyone with underlying health conditions. Please stay home if you feel sick to help protect others. We must continue to practice good hygiene, keep washing our hands and covering our coughs and sneezes. We still need to limit our travel, stay close to home, and only go out for essential needs. And those who can work virtually are encouraged to continue doing so when possible. We know this pandemic has brought significant challenges, and we need to continue taking these precautions to reduce the spread of COVID-19. In addition to continuing those safe behaviors, the state has outlined a statewide face covering policy. Face masks are required for employees at grocery stores, pharmacies, public transit, personal services like salons or barbers, and rideshare drivers. It is also strongly recommended that these businesses require their customers to wear masks for maximum protection of everyone involved. For everyone, it is strongly recommended that we all use masks in any indoor public space, especially if 6 feet of physical distance cannot be maintained. Amid these changes, we will continue to maintain critical city services such as police, fire, and emergency medical services. We also continue to provide many city services online, by phone, by appointment, and by email. We are looking at a number of ways that the city can enable restaurants and bars to use outdoor space surrounding their premises to increase the amount of space available to safely serve patrons. We have an email that goes directly to the team working through these logistics and through the logistics of these ideas, and we encourage businesses to contact us through that email, bizhelp@eugene-or.gov, bizhelp@eugene-or.gov. I want to thank everyone for your collective efforts to stay home and save lives over the past several weeks, and helping to flatten the curve to protect our vital healthcare system. Thank you. And now, I turn the podium over to Mayor Christine Lundberg of Springfield.
Thank you, Mayor Venus. We are pleased the Governor's Office has approved Lane County's application to move into phase one. This is an important step in our effort to reopen Oregon. As we enter phase one, there are state guidelines retailers and other businesses must follow, even as restrictions ease. To help businesses understand state guidelines, the Springfield Chamber of Commerce and the Eugene Chamber of Commerce have developed a resource guide with the small business owner, manager, and personal service provider in mind. I want to thank the chambers for developing this asset and the economic development staff at Springfield, Eugene, Lane County, and Travel Lane County who offered their support. In the Back to Business Guide to Reopening, there are resources for retail establishments, restaurants and bars, outdoor recreation, personal services, hospitality, and the community. It includes the state guidelines such as limiting the number of customers in stores and maintaining 6 feet of distance between people. The guide also outlines other state requirements such as cleaning, especially high traffic areas, and commonly touched surfaces. We are working on a Spanish language version of the guidebook to be made available soon. I encourage everyone, not just business owners, to familiarize themselves with the state guidelines so we're able to support local businesses as they adjust. While some businesses may be ready to reopen, please be patient as each one works out how to best meet state guidelines and the needs of their employees and customers. And as always, please continue to reach out to Lane County, your city, and your Chamber of Commerce should you have any questions. We continue to welcome your feedback and work to answer your questions. We are in uncharted areas, but we are in it together. Thank you. I'll now welcome Jason Davis.
Thank you, Mayor Lundberg, and thank you to all of our elected officials. Again, we have said this before, but it is truly one of the hallmarks of this entire effort has been the way in which our various governmental entities have worked seamlessly together on the response, and that's exactly what it's taken to get this far. Just last night I spoke with some neighborhood associations, and we've seen that work extend down to that neighborhood level, and some really encouraging work happening amongst our communities, and it's exactly what has made us able to enjoy the current situation of low cases that we have. That obviously, and the fact that the majority of Lane County people really have taken COVID and this outbreak to heart, so to speak, and treated it with the level of seriousness that it deserves, staying home when they've been asked to, and really looking at how to stay healthy and keep their themselves and their family healthy. I'd like to begin with a brief case update. We are still at 60 confirmed cases. That has not changed since the last time that we spoke with you. We have one presumptive case, and over 6,640 tests have come from Lane County to our local labs and regional labs. We have 31 individuals who are under monitoring. These are 31 individuals who were identified through contact tracing. So this is exactly what we want to be seeing, is having a wide group of folks that we have a handle on whether or not they've been exposed and are able to monitor those individuals and keep track of their condition. That is what will help us as we move through this phase. Of our cases, we have nobody in the hospital. We have 54 individuals who have recovered. So we know that case number will change as we have new cases pop up and continue to see individuals recovered. We still have only 2 individuals who have passed away and only 5 folks sick at home currently recovering. So the big question is, what does this mean? What does the restriction relaxation mean for public health? What does it mean for our community? For public health, it means that we have a lot of work to do. Certainly this in no way, shape, or form means a slowdown for public health. Our contact tracers will inevitably be dealing with more contacts per case as people go out and about. It means that we need to message out to our community what the restrictions really are and how to abide by these restrictions and what the relaxation means. That's going to be a focal point for us. And then certainly, just acknowledging the fact that this is not normal. What the phase 1 is a slight change to those stay-at-home orders. It'll be a significant change for some of the businesses affected. Certainly folks will go back to work at potentially new capacities. However, the disease is very much still present in our community, and our vigilance around maintaining our current situation is more important than ever as we go back to some semblance of gatherings and being out in public places to a greater extent. I think it's important for us to really realize how this affects individuals. So with the stay-at-home order, we're looking at broad accountability over all of our communities. Everyone is in the same situation, and that's changing slightly. There's more personal accountability. Each one of us has a greater role to play now, not just staying home, but really as you start to go out, acknowledging the fact that wearing a mask can be an effective way to help prevent the spread of COVID. This is not a political issue. This is not a preference issue. This is science. And we need to make sure that we understand that and that we treat it as such. hygiene, washing your hands, covering your cough and sneeze, those things that your mother has told you as you're growing up, those still absolutely apply and are more important than ever. And you know, when we think about what the implications of not doing some of these things are, not keeping that 6 feet distance between ourselves and someone else, not staying home as much as we possibly can, the implications really are going backwards in this process, and we don't want that to happen. Public Health is committed, as we heard in the governor's press briefing today, to both pursuing an economic recovery and maintaining our public health condition that we've enjoyed so far. So we really want to urge our community as partners and thank you first off for the work that you've done so far in getting us to this place. That's largely because of our community's commitment, but then really double down on our commitment to maintain good health here in Lincoln County. As Commissioner Buck mentioned, we have ordered 6 machines, rapid testing machines for our community health centers of Lane County. Each one of those machines can process up to 470 tests per day. However, they will not likely be operating on that kind of capacity. That is largely due to the amount of reagent supply that is currently in shortage. That has not changed. You may have seen varying reports about that, but really in terms of Lane County and what we're able to access here, we still are limited. And so folks need to shortages on the other side of things, and we will be working to try and get more now under phase 1 and some of those industry and sector specific guidances. As our mayors pointed out, our chambers really work together to create a very easy to understand guide that's listed on their website. We also have information on our website at our coronavirus website for the county. If you go there, there's some drop-down menus, some FAQs where you can get more information about the implications for businesses by sector, and then also certainly what the personal responsibilities are going to be. In terms of what guidance is still outstanding, we do know that childcare guidance has been listed on the state's website. So guidance is still coming, as is specific guidance around gyms. We did hear the governor make mention of that earlier today, but we expect there to be more posted shortly. We would also like to get out there for our community just to understand that prevention and preventative care is an incredibly important part about for your health. And right now, preventative care and seeking that preventative care is safe to do by visiting your local provider, your primary care provider, and or your hospital setting. We've been working with our providers here in Lane County over proper safety measures, and we can confidently say that your doctor's office is a safe place to go. In fact, if you call many of your providers, they will have a pre-recorded message telling you all about the safety measures that they've taken. And I encourage folks to talk to their providers about that. And also telemedicine is an effective way to seek care, but we just want to make sure that our community understands that while we are moving forward through these phases and while we are pursuing health on that front, that your health outside of COVID is still very much an important factor, and also important to the way that you would cope with COVID should you come into contact with it. So please do get back to your regimen, your health regimen, make contact with your primary care provider, and take those important steps to staying healthy. At this time, we will take any questions from members of the media.
Two questions from Sam at KEPW. What are the barriers to testing up to 5,000 a day in the near future?
So a couple questions from Sam at KEPW Radio here in Eugene. He wants to know what the barriers for testing up to 5,000 people per day are currently. And so that mark, Sam, is not necessarily one that we are looking at right now. What our health officer has really put as a goal for us here locally is 1,000 tests per day. I think we are actively on our way to having that capacity in terms of equipment. Where the slowdown and the problem really is in the supply of the chemicals needed to actually process the test. Both the rapid test machines and the traditional lab equipment necessary to process those tests require several different chemicals. There are patents on those chemicals and therefore controlled through supply chains. And we have to order just like any other health location or any other care setting. And there's a huge demand for those chemicals nationwide. Some of those chemicals are being prioritized to areas with hotspots. And so we are in the mix of all that, so to speak. And so that's one of the reasons why we can't see the capacity open up here in Lane County. So hopefully that answers your question.
The second question is, are we prepared to see potential cases of pediatric inflammatory multisystem syndrome?
So the second question is, are we prepared to see the condition that has been publicized in the last week or so, where we've seen some of our younger folks come down with an inflammatory condition, has multiple different symptoms to it. And the answer to that is yes, we are monitoring the situation and monitoring the symptoms and the indicators, early onset indicators of that condition. We've been discussing it on our provider calls and our health officer is trying to update our hospitals. They obviously are on top of this as well. So like any illness, it's a matter of information and a matter of spotting it early and trying to keep a good idea on what's going on with our county. I feel as though we are at that place and the communication channels between public health and our hospitals are open and free flowing. And so as we learn more about that condition and we're able to diagnose it early on, the better we will be at detecting that.
2 questions from Brian at KZI. The first is, who will be monitoring the county's progress to see if and when we're ready for phase 2?
So the first question from Brian at KZI is, who will be monitoring the county's progress as to whether or not we are eligible for phase 2? And Brian, that will be public health. Public health has worked very hard over the last month and even before that to establish systems for measurement and then numerical thresholds to be able to look at those systems and judge whether or not that information indicates that we are able to progress through this process. And so things like PPE counts, things like burn rates on those PPE are all being measured. Our hospital capacity is actively being measured on an hour-to-hour basis. We're tracking that. Our case rates are certainly being measured and they're getting more accurate as we are testing more people in the community. Our Sentinel testing program is actively out looking at some of our most at-risk community members and trying to get a handle on what the situation is for COVID in those communities. So we have those infrastructures in place and actively monitoring the situation. So what we're specifically looking at around cases is a doubling of cases over a period of time, or 3 cases per day for 3 days that are not epidemiologically linked, or there's not a connection between those cases. That's where we would really start to see a problem. And then we would be talking with the governor's office about what that means for our county and what that means for phase 2.
His second question is, will there be progress reports during phase 1?
So the second question from Brian is, will there be progress reports for phase 1? And Brian, we will have real-time information on our website. If you go to our COVID website and you click on Blueprint for Reopening, you'll see a table there that has all the different categories that we are measuring, and that is applicable for both phase 1 and phase 2. And so you can keep up to date where we are on those. So while there may not be a formal progress report, we will be communicating that information, and you can also track it on our website any time of the day.
2 questions from James with KORE.
Okay.
What progress has been made in Lane County's Sentinel testing program, specifically in testing at the 60 long-term care facilities referenced by Dr. Ledke?
So James from KORE wants to know what progress we've made on our Sentinel testing program, specifically the long-term care facilities. He had an interview last week with Dr. Ledke, and Dr. Ledke mentioned that. So James, I'm happy to report that we have almost 300 tests that have been done within our unhoused community, looking at our respite shelters and also some shelter care locations and some other facilities within Lane County. As you are aware, and just for the benefit of our community, the next step in that process was looking at our long-term care facilities and trying to test in there. Now, there was a problem when we started doing that. We found out that there is a policy from DHS that indicates when testing is done at a facility, they have to cease new admissions. And so that was a barrier to pursuing some of that testing. We believe that we've achieved a workaround on that and have some facilities lined up. That testing will begin next week. and the planning for that and just the considerations that need to happen in advance are currently being done. So we anticipate that actively rolling out.
His second question, is Lane County any closer to conducting testing for all frontline workers?
So the second question is Lane County any closer to conducting testing for all frontline workers? That is certainly something that we're working at as we're looking at testing for at-risk groups. Those frontline workers are certainly at risk. This is already happening in our hospital settings where they are testing all their staff. And certainly we're going to be looking at other areas where we can provide that testing as we get more capacity. So that is certainly on the list, James, and a priority for us. And it's also important information for our community.
So our next question is for our elected officials.
All right, and we have some questions for our elected officials, so I will go ahead and clean the podium and allow them to address those.
And Mayor Guinness, if you could repeat the question. What are some of the things you credit that have made it possible for us to open for phase 1?
So the question is, what are some of the things we credit for enabling us to open in phase 1? And I think there are two big points here. The first is the coordination between the county, Springfield, and Eugene has been very close and very consistent. So we've enabled the whole large metropolitan area why we are where we are today.
The second question is, what are some of the next steps that city will be taking to bounce back from this downturn?
So the second question is, what are some of the next steps that the city of Eugene will be taking to bounce back from this? And I mentioned this in my opening remarks that we are doing an outreach to the business community. Each business has a unique set of circumstances and concerns about how they will reopen safely, how they can conduct their business under safe distance expectations, how they can keep their employees safe. And so we have created a direct access online. We have a business group that is working with businesses, so that bizhelp at eugeneoregon.gov is a way that people can get information. So we will be kind of in a consistent way and in a sustained way, because this will be an ongoing process as we kind of wrap our arms around how people remobilize in our community. Thank you. Oh.
So the first question is, what are some of the things that you credit that have made it possible for us to open for phase 1?
So I'll just repeat the question for everybody, which is, what do we credit to having such in our public health department so far to get into phase 1? And I really credit our early response. We were talking about COVID-19 and setting up our EOC prior to the stay home, stay safe order. So we were already preparing for this in advance and had been watching it very closely. I think that helped in our early preparedness for the community in general to know that this was coming and to be on top of the latest information.
The second question is, what are some of the next steps that the county will be taking to bounce back from this economic downturn?
And the second question is, what are the next steps for the county to bounce back from the economic downturn? For the county, we have an economic development officer who's been really solely looking at what recovery can look like and where we can get resources. We expect to be able to apply for funding from either the state or the federal government in order to bring back some dollars here for our local businesses. Hopefully that means more money for revolving loan funds, but also other economic development dollars for various industries.
So the first question is, what are some of the things that you credit that have made it possible for us to open for phase one?
What I think that we can credit for opening with phase one is our phenomenal partnership with Lane County and with the city of Eugene. We work all the time together. In this case, it was in an emergency scenario, and we've been working most recently on the idea that we would have a Cascadia event. So I think we just moved into a different phase of working. And but I also want to thank all of our first responders. I want to thank all of the healthcare workers and everyone who has been going to work and grocery stores, etc. Everyone who's been out there working, everyone has been phenomenally cooperative and understands the severity of what could happen, and I appreciate that they've done that. Our hospitals have been stellar with us, Mackenzie Willamette, and King, to make sure that we were able to meet the criteria for reopening, and all of the work that we've done together is most appreciated.
The second question is, what are some of the next steps that the city will take to bounce back from this downturn?
Some of the steps that the city is going to take to bounce back from this is to also work at our plan. We have a plan in place. I want to give our Chamber of Commerce credit for working with us, that we are going to have an economic recovery, and then also make sure that everyone's healthy. So we are going to meet as a council next Monday night to talk about what that plan is. I can't emphasize enough that it's going to take the city, it's going to take our business community, and it's going to take everyone going out to make this work, because there will be a lot of changes. I tell everyone all the time, there'll be a lot of changes. You won't go into a restaurant the same as before, or into some of the other businesses. The changes that occurred in grocery stores, etc., places that we're still all going to, there will be changes in the additional businesses. And it'll take all of us, whether it's the businesses or all of us, out to make the new plan work for how we get into the recovery. And looking at our budget, the budget committee met this week, and there are going to be a lot of changes to our budget too. So it is uncharted areas, but we working together. Thank you to everyone for being wonderful communities working at this pandemic and getting us to this phase one opening. Thank you so much.
So, Mayor Dennis, what is your message to the public and businesses that may continue to be impacted by ongoing limitations, specifically that may limit their ability to benefit from football season?
The question for me is what is my message to businesses who will be impacted by ongoing restrictions, especially large gatherings on the football season? My message is that we're all feeling the same level of tension and anxiety. I have weekly Zoom meetings with different groups of businesses, and I hear from them weekly about the tension around how much to open and the uncertainty. We're all eager to see things resume to something closer to normal, the possibility of gathering. We all really want to be out there to root for the Ducks, and it's painful for all of us. The message is that, as we have said all along, it is the virus that drives this, and we make our decisions as we go along to look at the greater public health, and we are trying to ensure that as we reopen, we continue to keep people healthy. So we will look for innovative ways. We are hoping that the University of Oregon will be able to resume, and students will be on campus, and they'll be able to hold football games. We are still in a changing landscape, so we all share the same hope, and we're all in this together in terms of just taking our best steps forward to protect the public health. Thank you.
Thank you, Mayor Venus, and that concludes our press conference for today. We will be back with you this coming Tuesday. Thank you.